with regards to the data, that's actually a really, really good question. So our numbers are definitely an underestimate because, firstly, we weren't testing everyone. We were, as the testing system was completely overwhelmed, we only, from I think June, we only tested people who were either high risk or hospitalized or who were healthcare workers. So we weren't even testing everyone who was symptomatic. And we know that there are also a lot of people who are asymptomatic. So from a data point of view, that's one challenge. But I was really lucky that where I work in the Western Cape, we have a particularly good data system, and something that the University of Cape Town has been working on for years and has suddenly received a lot of attention now is they've created this thing called the Provincial Health Data Center, where they pool together all the different data sets. So the pharmacy information, the lab information, the appointment system, and they put it all together in one data set, which sounds very obvious and like that should be the way it is. But in most places, it's not. Most places, you have all of these different pieces of information, and if you want anything on a patient, you have to look in all the different places. And because the Western Cape already had this system that they've been trialing out for the last couple of years, when COVID hit, they were able to use this provincial health data center to input all of the COVID information. And it meant that they not only have all of the information on the COVID cases in the Western Cape, but they can tie it to those people's records from the last 20 years that they've now been digitizing and pulling into this data center, which means that they've got this massive data set of information that they've been looking at, and that's where the information about the risk of, what the actual risk of HIV is for COVID mortality, and from that information is where we found out that it's actually only about 2.5 times higher risk of dying from COVID if you've got HIV. And so I think most places did have a problem with data quality, but where I worked, despite the fact that it's sort of low resource setting in Khayelitsha, we just happen to have this incredible data set that is quite unique.